I want to talk about drug and substance abuse today. So, first, what is drug and substance abuse? This is anything that when it is taken, it changes or alters the normal functioning of the body. And this it can lead to when you take overdose or underdose. That is also drug abuse. So drug abuse, it has caused many problems in our families, and today we're going to discuss the effects of these drugs and substance abuse to a person, what it causes, the changes that it may bring to you as a person. And we are going to start with some of these drugs. I'm going to name them one by one and causes to a person. So let's start with alcohol. Alcohol, it causes one, brain and nerve damage, impaired visual ability, this is when you don't see clearly, altered sense of time and space, and then not able to walk straight, hence you are staggering. And then we have loss of pain perception, this is drunkenness, and realizes that they were injured after subbing up, like when you have become sober now, that's when you realize that you got injured. And then we have unclear hearing, that's why people shout when they are drunk because they cannot hear well. We have slow reaction to time, making one vulnerable to accidents, yeah, that is it. And then we have to the liver, it becomes enlarged, like enlargement, hardening. And then cancer, we have this is now cirrhosis, and it can also cause liver failure. And then alcohol to the heart, it causes enlargement, it damages the valves, and then it causes high blood pressure and heart failure. And then to the stomach, it causes ulcers, stomach cancer, and other gastrointestinal tract cancers, e.g., mouth, throat, duodenum, and intestines. And then it causes poor readaptation or reabsorption of water, causing dehydration. Frequent passing of urine, that leads to early death. So in reproductive organ, it causes one, poor quality sperm or ova, it deformed or lacking important parts like the tail or the nuclear. And then lack of sexual arousals in some long term, that is like impotence or frigidity. So that's all about alcohol. Let's talk about the second one, which is tobacco. So when you ask participants if tobacco smoking is a problem in the community, what are the contribution factors for them? And then what can the CHV control by use of these tobacco products? So let's do this. Tobacco, it contains some 4,700 ingredients. Out of these, 400 are known to be very harmful to human life and health by way of causing cancer. So to the mouth, smokers, they experience dulling of their taste buds, and then irritation in the mouth, gum disease, bad breath, and numbness. And then we have staining of teeth and even failing off. And then we have increased chances of cancer of the mouth. That's now about the mouth. When you are taking tobacco, those are the dangers that you were likely facing. And then we have to the throat. Tobacco causes cancer of throat. It irritates the membrane of the throat, causing it to become sore. And then to the heart, tobacco increases heart rate and blood pressure, which increases a person's risk of heart attack and stroke. And then to the liver, smoke causes liver to harden. And then to the lungs, Smoking progressively limits the amount of airflow into and out of the lungs. Tear and other constituents causes lung cancers. And then to the reproductive system, smoke reduces sex drive and increases the risk of impotence in men. And then in women, there is increased risk of cervical cancer, increased risk of miscarriage and pregnancy complications. When we talk about bang, when we talk about bang, is bang common in our communities? Of course, bang is very common. So facilitators, we have to summarize this in the following keynotes: deformed babies, false confidence, spontaneous laughter. We have short memory loss, confusion of past, present, and future. We have hallucinations and paranoid feelings. We have poor quality of sperm in men and painful periods in women and loss of sex drive. And then you have to note this, that effects of bang have left many years of stopping its use. So effects of bang are felt many years after stopping using it. So let's talk about mirror. Mirror, this is what it causes: memory loss, it brain crashes or amnesia. We have personality disorder and depression, mouth sores and ulcers, tongue, lip, which predisposes to an individual in order for the person to get HIV and AIDS. We have oral cancer, nerve damage leading to the numbness. We have hallucination. This is like this disorganized and paranoid. We have excessive irritability, and then chronic consumption. This is now slow passage of food through the stomach and intestine. And then impotence in we have impotence in men and frigidity in women, lowering of happiness during sex. And then we have inhalants. Inhalants, they cause dizziness, vomiting, and tremors. We have first phase of euphoria and hallucination. We have slurred speech. We have irregular heartbeat, and we have violent behavior. And we have damage to salt issues in nose and mouth, resulting in loss or of ability to smell. And then we have loss of appetite, that is inhalants. So when we talk about shisha, and we're going to talk to finish at shisha, this is an an imaging drug which is flavored from is a flavored form of tobacco that is made to appear less harmful than other types of tobacco. It is usually smoked using a shared pipe, hence it can lead to transmission of communicable diseases such as TB. In some instances, other drugs such as heroin, cocaine, and balm are added to this mixture. A puff of shisha is equivalent to smoking 20 cigarettes. So when you just take one puff of shisha, it's like you have taken 20 it's like you have taken 20 nini of cigarettes. So it's very harmful.
So here I have some of the factors that may be influencing youths to include themselves into drug and substance abuse. And some of these factors, they include poverty, peer influence, stress, poor parentage, unemployment. We have influence of Western culture. We have influence of social media. We have weak laws. Yeah, weak laws. So, for example, in the household and in the initiatives has the community employed to fight drug and substance abuse. They are like educating the community on the negative effects of abusing drugs, yes, We have counseling the youth, creating awareness programs. We have prosecute those dealing with drugs. We have church campaign against drug abuse, total ban of drug abuse. We have public barazas. We have seminars on dangers of drugs. We have creating activities to keep the youth busy, like sports activities. We have rehabilitation centers. And finally, we have discourage uncensored films and videos. So that's all about drug and substance abuse. Thank you. Like, subscribe, comment, and share widely.